Good afternoon, Doctor.
Good
Dr.
afternoon.
Asim A. Shah is a professor in chief with the Division of Community Psychiatry at Baylor College of Medicine. He's the Chief of Psychiatry at Ben Taub Hospital or Harris Health System and the Director of the Mood Disorder Research Program at Ben Taub. Welcome, Doctor.
Thank you.
Doctor, you have an extensive knowledge in the field of psychiatry and more specifically in mood disorders. Can you please explain to our listeners a little bit more about your background and how you chose this field of study?
Very good question, Erin. I actually always wanted to be a cardiologist, and here I am, a psychiatrist, because I guess soon, about maybe 30 years ago, I realized that this is a field in which a lot depends on what a person says, as opposed to tests and imaging and EKGs. So I thought this is a field where I can use my mind the best way and help others. So that's how I ended up becoming a psychiatrist. But originally, I wanted to be a cardiologist. It's a long journey there.
Okay, well, that's interesting. That's a big switch. Considering that background and how it's shaped your research and how you've gotten here today, especially given the circumstances that we find ourselves in, how would you say that that background has helped you in your research?
Yeah, that's a that's a good question also. That background helped me in research because I have always integrated physical illness with mental illness. I'm currently a professor of family and community medicine also. I believe that mind is connected with body. So mind is not alone and body is not alone. So mind and body both need each other. That is the reason I like to work on aspects in which I will think about, for example, depression after cancer, or depression with bypass, or things like that, or heart surgeries, or physical illnesses. So I like to connect always medical illnesses with mental issues. And I think that is always the way to go, because if you only consider mind as a separate entity, that is not the right approach. Integrated approach is the best, and mind and body both are so connected that you have to keep both in mind while thinking about any disease, any illness. And the recovery of most medical illnesses depend on your mental well-being. If you are mentally healthy, less stressed, you are going to recover quicker. All the studies have already shown and proven that.
I love that. I couldn't agree more. Mind and body are connected. And on that note, I kind of want to talk a little bit more about mental health basics for those of our listeners that may not have a lot of background or knowledge in this field. What are some key factors and outside elements that are associated with and impact our mental health?
So there are a lot of key factors which can impact anybody's mental health. So for example, environment, how you are living, what is the environment around you? Is it a stressful environment? Family upbringing, that has something to do with it. Substance use, drug use, that has a lot of part to play with mental illness. 60-70% of our patients, their diseases get worse because they're using substances. And lastly, the myth that people feel that, oh, you cannot be depressed because your life is perfect, you're rich, you have money, and all of that. That is not true, because we have things coming because of chemical imbalances. So, for example, even for depression, we have exogenous depression, which is coming from outside, maybe because of a stressor or losing a job or financial. But then you have endogenous depression, which comes as a chemical imbalance. So, if you think about mental illness, you have to think about chemical imbalances, which could be dopamine, serotonin, norepinephrine, whatever it is. It could be your environmental factors, your socioeconomic factors, and of course, the ability for a person to handle stress. That will be different between you and me, or me and somebody else. Everybody has a different ability to handle stress. So I think all those combined will make somebody have a mental illness or not. And by the way, I don't prefer to use the word mental illness, because we talk about stigma a lot. And when we talk about stigma, the word mental even has stigma in it. So maybe psychiatric illness, maybe brain health or whatever, but the word mental in itself creates a stigma.
Right. On those lines, doctor, COVID-19 has had a very severe impact on people's, not only on people's physical health, but also their emotional well-being. Have you seen any shifts in the demographics in regards to mental health challenges between earlier in the year to today, to now?
Yeah, so COVID-19 started February, maybe March. We had a lockdown in most places in March. Since February and March, we have tracked emergency room visits. What we have seen is that people are going less to the emergency room for medical illnesses. Why? For example, if somebody has chest pain, stroke, or anything, they prefer to try to deal with things at home because there is a fear of catching COVID. So they will go to the emergency room only if absolutely needed. As opposed to this, psychiatric patients are going more to the emergency room with suicidal ideations, with depression, with anxiety, with increase in drug and alcohol usage. And what we have seen in the emergency room, in the emergency room numbers, about 30%, or in some cases 35% increase in visits to the emergency room by psychiatric patients. So that's an enormous increase just in the last 8, 9, 10 months. One. The other thing is demographics or certain populations. What we have seen is that COVID-19 has affected the vulnerable population even more so. We know that. Hispanic population is affected more, minorities may be affected more, people with lower socioeconomic status also initially were affected way more than others. But that's the population you end up seeing in the emergency room who present with mental illness or psychiatric illness. So it is very similar to what we are seeing in COVID, meaning if we are seeing the racial disparities with COVID, we are seeing the same when it comes to emergency room visits of psychiatric patients. We're seeing that, and that hasn't stopped, that hasn't slowed down. We've also seen a lot of teenagers, young people, coming with severe depression, coming with even suicidal ideation, and in some cases completed suicide, because that is a group which usually is not able to handle the isolation. Others are, but they are not. So that's a problem in itself for them.
Right, right. So how would you say mental health resources have been impacted by the pandemic?
Yeah. So pandemic caused some shift in mental health services. Some is good shift. So hypothetically, the good shift is telehealth, telepsychiatry. Since we don't necessarily have to touch our patient, do an examination, we can basically see a patient even on a video without a problem. So that was a good shift because nobody wants to come, nobody wants to leave their house, especially in this time of the of COVID or pandemic. Telehealth, telepsychiatry was something which was good. We were already doing it. We basically sort of fast tracked it, just like Zoom was already in existence, but COVID perhaps made it fast tracked. So that is a good thing. The challenge we have, though, with that is that a lot of our patients may be unable to handle technology. If you're talking about lower socioeconomic group, they may not have a smartphone necessarily. If you're talking about homeless population, psychiatric illnesses are very common in homeless population. It is not easy for them to even keep a phone because if you're homeless, those things are stolen. If they have a nicer phone, the chance of being stolen is even more so. So those are challenges. If you're talking about geriatric population, it is a little challenging for them to start a video or a smartphone. And lastly, people who are on Suboxone or those kind of controlled substances, we prefer to see them in person. So while telehealth has been very helpful and overall has helped our specialty a whole lot, of course there are challenges, but that's with everything.
Many of us, doctor, have had a real difficulty with some of these issues. So what are the steps that people can take when they have difficulty, for example, concentrating, falling asleep during the pandemic, especially when people cannot really follow a normal routine?
Yeah, we have seen people not having any structure with COVID. People are at home, So they don't have to go to work. They are working from home, maybe in their pajamas, maybe just waking up 2 minutes before they have to start to the work. So the whole structure has changed. Now, while there is no structure, and structure is very good for life, the other thing which we are seeing is lack of exercise. No walking, no going to gym, or if you go to gym, it's less than before, no running. So all those things have caused a sense of laziness in some. I think the biggest advice I would like to give to everyone, which I usually give to all my patients, is even if you're working from home, try to create a structure. Try to wake up the same time every day. Try to go to sleep almost the same time every day. Try to change and be in the mode of working if you're working from home. Try to exercise some, go out, walk. Walking is perfectly fine. Get some fresh air. Go in your backyard or something. So we need to have some positive change in our life and some structure in our life. If not, you tend to get tired. If not, you tend to get lazy, and all these complications start.
Right. And in addition to all of that, winter's in full force, which means a lot of people are not only grappling with the pandemic, like you were just saying, but also SAD or seasonal affective disorder.
Correct.
Can you go into that a little for our listeners who may not know much about that subject?
Sure, sure. So, seasonal affective disorder is something which is present during winter seasons a lot, but we have seen some variant of seasonal affective disorder in summer also, actually, but mostly it is winter. Basically, the theory behind that is that sun is biggest motivator in terms of giving you energy and motivation to do things. In winters, when days are shorter, you have more darkness than bright days. People tend to get a little depressed, and they tend to be by themselves. They're withdrawn, they lose motivation, they lose energy to do things. And that is the reason it's implicated in many cases that those patients can perhaps use light therapy. They don't necessarily have to buy expensive lights. Even having bright light in your house or having bright walls is better than nothing. You see a lot of people who suffer from seasonal affective disorder that they have dark walls, dark curtains, very minimal lights, and that makes things worse for them. So just brightness in everything, whether it is light or walls or blinds or curtains, that also helps. And again, getting sun as much as possible. Vitamin D is something you get from sun, and lack of vitamin D in simplicity causes tiredness, fatigue. And one of the symptoms of lot of these things is fatigue and tiredness. So if you get vitamin D, uh, you will not be tired. So sun is very important for everybody. So seasonal affective disorder is something which affects people during winter season mostly. But like I said, there is a variant seen in summer, but most commonly it is seen in winters in areas where you have shorter days and people tend to get depressed and so forth.
The holidays are around the corner, which is already an increasingly tough and challenging time for people around the country. Why is it that the rate of depression increases so much during this time of year?
Rate of depression is always high during holidays. We talk about post-holiday holiday blues all the time. So why do we talk about it? Holidays can be stressful for many reasons. So first, in our culture, in our society, holidays are a time when people get together. So if you have kids, grandkids, they are usually supposed to see you. So there is a gathering, there is a get together. But of course, having said that, some people, and right now I'm talking about pre-COVID, some people are unable to get together because of finances, because of their schedules. So they may not be able to see their mother or father or grandparents or so forth. And that causes depression in those people who are unable to see you. That is one. Second is the holidays are also a time when people exchange gifts. People who have money can easily do that, but people who are financially struggling, that can be a challenge for them. So that's a second stress which happens to a lot of people. And third, holidays are also a time when you end up seeing people who you may not necessarily want to see. Some family members who may annoy you, some friends who may annoy you, some in laws you don't want to see ever, but you have to see them during holidays. And that is an added level of stress for those people who are facing that. So finances, inability to see your loved ones, and ability to see the people who you don't want to see. All these combined cause a lot of holiday stress. Come to COVID and pandemic. what has pandemic done? So again, socialization has been restricted. People who would otherwise go and see their parents or grandparents, some may still do it, but others may not be able to do it because of COVID. So that's a stress. Finances. A lot of people have lost jobs, and finances are tight. So they may or may not be able to give gifts as they were doing it before. So that's a second stress. So holidays in itself causes stress, but COVID has increased that stress because of the reasons just explained.
During the pandemic, we've also seen that suicide rate has widely increased. Can you comment on this and the impact it's had not only on individuals, but the individuals' loved ones and society as a whole?
As mentioned before, suicide rate has definitely increased in the pandemic, and we will see the actual numbers really sometime later, but we know that it has increased. We have also seen completed suicide. There are a couple of groups which are strongly affected by that. Initially, we saw the elderly group, which was very affected with depression because they were left alone because the disease was thought to affect only elderly population. Now we are seeing young people, people who are less than 24. If you think about it, the number one enjoyment or the only enjoyment for people who are less than 24 is outdoors, playing sports, going out for movies, eating out. So everything they have done is usually outdoors. Suicide is the second leading cause of death in people between the ages of 14 and 24. And the fear is that if nothing is done, and if this pandemic continues, it can become the number one cause of death, which is very serious. Another thing which we forget is that traumas, disasters, stresses affect people's mental illness for a long time. To give you an example, 9/11, after 9/11, people had stress, PTSD, trauma for up to 4 years, 5 years, 6 years. Katrina, people had PTSD and depression 4 or 5 years after Katrina. Hurricane Harvey, 3 years, people still come with depression and PTSD. But those were all one day, few hours stress or trauma. COVID is a disaster, is a trauma, is a stress, but it's an ongoing stress. We are in the 10th month of COVID, and soon we will be about 1 year in COVID. So if you think about one day stress causing that much and that long mental health issues or psychiatric issues, a pandemic which has caused mental health, which has survived a whole year or longer, would cause mental health issues for a decade or even more so. That's a big worry for us because right now people talk about mental illness, but hopefully when things are better, unfortunately people tend to forget about that, and this impact can be very, very long, and we need to be prepared for that.
Doctor, I wanted to get a bit more in depth with some of those who battle the stresses and the impact of COVID so directly. Can you please comment on how the situation has been different or maybe even more challenging in terms of mental health for essential and frontline workers?
COVID has been very challenging for frontline workers for numerous reasons, and you have multiple fears. The first fear always has been and still is that are we going to catch COVID? Luckily, the vaccine is out. Most of us are getting the vaccine. So hopefully that fear should be over and better. But until now, the fear has been that are we going to catch COVID? That's the first fear. The second fear is that are we going to catch the virus, go home and give it to our loved ones? That's the second fear. The third thing which has been very destroying and very stressful for all the healthcare professionals, the first liners, most of us have had busier schedules. Most of us have been more stressed at work because we have to work more. And unfortunately, in most cases, with less pay. Pay is not the only answer, but still compensation matters. And this is the time where frontliners, physicians, you will see their salaries being cut as opposed to being increased because they're working more, their retirement being cut as opposed to staying the same. So you have work stress, you have fears of catching COVID, you have fears of spreading COVID to your family, your loved one, maybe if you have elderly parents to them. And then you have financial struggles. If you're a surgeon, a lot of elective surgeries have dropped. So there are a lot of issues even with finances. So all these make COVID a unique circumstances for physician in which we are not only mentally stressed, but it causes some level of financial uncertainty also.
Right. So, as we just discussed, healthcare workers are on the front lines of this terrible pandemic and are often stretched extremely thin. What kind of aid is really available to those who put themselves out there in these stressful times?
Yeah, the government has given some aid to healthcare workers who work in private practice. So PPEs, personal protective loans, have been available to physicians in their clinics and their offices, which they can use to give salaries to their employees and all that. So that's a good thing. As opposed to that, people who work in a hospital setting or in a university setting, they don't get those benefits. So they still suffer and they don't get those benefits. So that is one area that they have struggled. The second thing is physician works long hours, 60 hours, 70 hours, 80 hours a week. They tend to unwind by going on vacations. That has been a challenge this year and perhaps will be a challenge even in early next year, that it will be difficult to take some time off and go on vacation. So it is tough. Definitely some help has been available, especially for people who are in private sector, but it continues to be tough for others.
Right. And fear and anxiety about a new disease, especially for those who are susceptible and vulnerable to COVID, um, exists. So, how can we as a society help each other during these challenging times, especially for those of us who are alone during the holidays?
Yeah. Fear and anxiety continues to persist. So last week we were feeling hopeful, vaccine is out, everything is going to be good and better. But then you suddenly hear the news from Europe that things are getting worse and bad. They're canceling flights. The whole Europe is going almost towards a shutdown. There is a variant or a mutant of the current virus. So I guess the point is that some level of good news comes, but then it can be, surrounded by another level of bad news, which causes fear, anxiety, panic. So that has been the cycle, at least this year. So that's one. Now, how can we avoid that, or what can we do to help with that situation? What we can do to help with that situation is think about it rationally and with evidence. Evidence shows that vaccines are effective. We need to take that. Evidence shows that if you are taking all precautions, the disease may be not affecting you. Evidence shows that disease may affect less significantly, less severely in people who are healthy. So there are certain things which are evident by evidence, and we see that. It is hard sometimes to convince yourself because some of us, some of healthcare workers, may be suffering from diabetes, may be suffering from obesity, secondary comorbidities, and that's when the stress is definitely out there. So while you have evidence to show that even if the disease affects you, it is going to be hopefully mild, there are some cases where it becomes a challenge, and we try to just rationalize with each other with evidence, with the fact that good news is coming, there is light at the end of the tunnel. In other words, we are our own support system. We don't have any other support system other than our own self. So we truly are our own support system. We try to watch out for each other. We try to look for warning signs of depression amongst each other. If somebody is withdrawn, somebody is isolated, somebody is not talking, we look out for each other. So we try to do that. In terms of general public or general population, if you're used to having a big Christmas gathering or a holiday gathering and you're unable to do it because of COVID, maybe you can have some short gathering, mini gathering, little gathering in your backyard with some safe distancing and masking. If your family used to come and visit you, maybe this is time you can adopt a family. What about a neighbor who doesn't have family? What about a friend who doesn't have a family? Adopt new people. Because if you adopt a family here, maybe your family will be adopted by somebody else too. So I think those are some positive things we need to do for each other as a society. And we have to stay positive and optimistic. We don't have any other choice.
Thank you, doctor. Those are some really nice suggestions. We appreciate your time and you joining us and offering all that information today.
Thank you. Pleasure is mine.
Thank you.
Thank you, doctor.